Has this ever happened to you? You've been sitting down for a while and you try to stand up, or your body aches and you can't get up, or you feel a weird electric shock, through your hands when you try to open the door, or suddenly your back begins to ache and you're wondering what exactly is happening. Unfortunately, this might all be linked to menopause. The main reason why this happens is due to hormonal changes. As we lose estrogen when we grow older, our body responds in forms of aches and pains. Estrogen acts as a lubricant of sorts and even a shock absorber, and when there's less of it, we start to feel aches and pains. Today we'll look at 8 common types of pains that women have in their older years, and I'll share a few tips that I found helpful in managing mine. First is pain and stiffness in your joints. It could be your back, your shoulders, your elbows, or your wrists, or everywhere could hurt, especially if you've been in one position for some time, like getting out of a car after a long journey, or trying to stand up after sitting for long, probably while you were watching a movie. My advice is that when you first feel these aches and pains, is that you see your doctor, get an examination, an x-ray or an MRI if required. There are some natural things we can do to help these conditions. For example, although it may not be possible to stop arthritis, I know from personal experience that you can slow its progression by maintaining a balanced lifestyle. This includes maintaining a moderate weight, as difficult as it is, doing stretches, and then exercising regularly, protecting your joints from injury and trying to manage your blood sugar. You'll be amazed that there are dozens of stretches for every joint and every muscle in your body. Also, eat a diet that's low in anything that causes inflammation. In my case, I have something called carpal tunnel syndrome, which causes excruciating pain in my thumb and these 3 fingers, especially at night. And then recently, I have arthritis in my wrists. Painful and tender breasts. Some women experience tenderness, burning, or soreness in their breasts as they go through perimenopause into menopause. For others, it's a stabbing, sharp, or throbbing pain. Breast pain can occur in one or both breasts. Sometimes it feels like your breast is supersized, or there's an electric shock going through it, or like something is really biting you. And as a reflex action, you kind of like apply counter pressure with your hands. This pain and tenderness is usually due to the change in your hormones. But if you find a lump or a change in the shape or appearance of your breasts or your nipples, or if there's any discharge, please don't panic. The thing to do is to see your doctor immediately. Natural solutions for painful and tender breasts are to go and buy a bra that fits perfectly. Not too tight, not too loose, but at the same time provides adequate support. Sleeping on your back or your side at night would also help. You could also reduce caffeine, which is found in coffee, teas, and chocolates. And then you could try evening primrose and chastetree berry. Next is chest pain. This, in my own opinion, is the most frightening symptom ever. Many women report rushing to the hospital when the sharp pain starts because, you're so sure that you're going to die. These chest pains can occur at any time, day or night. There's no pattern, there's no rhythm. It lasts for a few minutes usually, and then it's gone. These pains can often be caused by changes in your hormones, but please let me stress the importance of seeing your doctor immediately you have these chest pains, because this could be a heart attack. It's better to be safe than sorry, especially as menopausal women have an increased risk of heart disease. One thing which helped me was taking really deep breaths, breathing in for as long as I can, hold it, and then breathe out. And I keep repeating this until the pain subsides. Painful cramp in your legs. This pain is the mother of all pains. It's excruciating. It occurs in your calf, and if you put your hand on your calf, you actually feel your muscle as hard as stone. It can be caused by dehydration, as the body retains less fluid as you grow older. The solution will be to drink lots of water, 8 glasses or 2 liters during the day to stay hydrated. Remember that the body retains less water as you grow older, so it's even more important to keep ourselves hydrated. So drinking lots of water is no longer optional. Stomach cramps. I've heard women complain about killer stomach cramps in their pelvic area. Some say it's around the time they're ovulating, others say it's a menstrual cramp. These cramps could also be caused by changes in our hormones, but it's a good idea to check with your gynecologist. After seeing your gynecologist to be sure that there's nothing else causing this pain, things we can do at home are to keep a hot water bottle and some mild pain relief handy, with emphasis on the word mild. Pain when swallowing food, also known as globus. Globus is the feeling of a lump in the throat when no true lump exists, or when you experience trouble swallowing when you eat or drink anything. It feels as if everything is really tight or extremely dry in the throat, and as if whatever is in your throat is stuck permanently, and you have to drink lots of water to help move the food further down your gullet. I learned that when estrogen levels drop, everything becomes drier. That even includes your saliva and mucus required to help our food move smoothly down our gullet or esophagus if you prefer. Also, doctors say that globus is nothing to worry about, that it's pretty common, especially when we get stressed and anxious. Globus might last days or weeks or a few months, but in my own experience, it went away within a few weeks. Solutions will be to relax, calm down, reduce or eliminate your stress in general. The truth is that some of us girls don't even know how to relax, period. Other things that can help are to ensure you drink lots of water daily. Drink water as you eat, reduce the size of each bite or mouthful, and make sure you calm down before eating. Hot feet sensation. I remember I used to get this at the beginning of my perimenopause journey, probably my very first symptoms. There's this heat from the soles of my feet, and it made driving and exercising very uncomfortable. I learned that this can be brought on by dehydration. So we also have to drink lots of water, up to 2 liters every day to stay hydrated. Headaches. These headaches are usually severe and sometimes last for a few hours. In extreme cases, however, they go on for several days. The pain can be one-sided, or you might feel as if there's a really tight band around your head, like when your headgear or your head wrap is too tight. I spoke to a lady a few weeks ago who said that there's a strange feeling in her head. It's pulsing or throbbing pain. It feels as if there's a bee buzzing in her head, which sometimes causes nausea and vomiting. These headaches are once again caused by fluctuating hormones, especially in perimenopause when we still have a menstrual cycle. Solutions will be to relax and take things easy. Get enough sleep and say no to caffeine. Intentionally reduce and, if possible, eliminate stress. Take a hard look at your life, your circumstances, things around you, and look for things, situations, people, places, or even thoughts that cause you stress, and then start intentionally setting boundaries. Always remember that you're not alone. If you have any symptoms or concerns you'd like me to talk about in future videos, please leave a comment for me and I'll be happy to do so. Take care and be your sister's keeper.